Hey guys, it's Dave. Today we're going to talk about seizures. Really, epilepsy is the main common disease that you have seizures for, but seizures can happen from several other things: brain injuries, alcohol poisoning, drug overdoses. They all can occur like that. But what I'm looking at today predominantly is with epileptic seizures. You have patients that can have two different types. You can have what used to be called the petit mal or the absent seizures. In those situations, a patient's still there. They can be enjoying a TV show, they can be at a ball game and be fine, but they're staring off into space. Mentally, it's just not registering with them. There may be some small muscle movements, some twitches. I had a friend whose leg would just kick out and fall asleep on him. Eye fluctuations can happen. Then there's the other one that basically everybody is familiar with, which is called the Tonic-Clonic seizure, which is the seizure where they lose bodily function. You will see the muscles tighten up or go completely limp. And they do not have control in that situation. Unfortunately, with that, a lot of times there may be a loss of bowel movement or urine, which happens with that. One thing I do want people to be aware of is you do not need to worry about a person having a seizure swallow their tongue. I've seen over the years things that they came up with as far as shoving it in their mouth to keep them from swallowing their tongue. You can actually do more damage to somebody trying to do that or yourself, because if they're having a tonic-clonic seizure, they're not aware of what's going on. They can literally bite you to the point of losing a finger, or they can break their teeth or their jaw even because they're so tightly clenched in a spasm. So do be aware of that. One thing that I do want you to know about, if you are a patient that has seizures, or if you have a friend or a family member that has seizures, there are things that can be done to lessen the chance of them having them. Of course, you want to talk to your doctor, more specifically a neurologist, because there are a lot more treatment options out there now than there used to be 20 years ago. And a lot of them have a lot less side effects. Back in the day, you had phenobarb, which basically you can have good seizure control with phenobarb. And if you're on it, I don't recommend you get off of it. However, it is very sedating, can really knock you out. But some of the things you can do to prevent seizures or having less of them, first off, get lots of rest. You do need to get a lot of rest, your 7 to 8 hours every night. When you lack sleep, you're more prone to have seizures. It's easy to say, but high stressful situations can cause them. So avoid that as much as possible. Things like exercise will help to reduce stress and also to help reduce seizures. You need to stay hydrated as much as possible. I know I preach it all the time, water, 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 but it is important in that situation too. First and foremost, you've got to take the medication you're prescribed. I know it can be a pain in the rear end. I know that you may have to take it 3 times a day. It's very important you take them as you're directed to take them. If you forget one, take it if you can as soon as possible, but if it's too close to the next dose, wait and just take the next dose. The other thing, if you're old enough, avoid alcohol or recreational drug use, because those can cause they lower the seizure threshold, making you more prone to have a seizure. There are certain medications that are prescribed that you also, and over the counter, that can lower your seizure threshold. Wellbutrin, which is a very common antidepressant, it's also used to help stop smoking, bupropion. That can lower your seizure threshold. So if you're put on that medication by your provider, make sure they know that, hey, I have seizures. Or if you suddenly are having seizures, you never had them before, and you're on bupropion, another thing you need to talk to your doctor about, because maybe there's another issue there that's causing this to happen. Then this one is actually an old one. When I was going to pharmacy school, Dr. Burnett, the University of Wyoming, had to dig out an old book to show me this, because I had a family member that was having seizures every time they would get a cold. And I said, you know, I know stress can do this, but come on, it's a cold. Pulled out the old book. A lot of the older antihistamines can lower your seizure threshold. So brompheniramine, clonpheniramine, Benadryl, diphenhydramine can do it and has a potential. So in little kids' meds, you're looking at things like Triaminic and Dimetapp, or the generics thereof. They have some of the older antihistamines which have the potential to lower seizure threshold. So if you're noticing that you got a kiddo, and doggone it, every time we have allergies or he gets a cold, he's got good seizure control all the time, but we give him that and suddenly we're having seizures. That's something to be aware of. And like I said, it took an old book for me to find that. And I really wish, considering all the things that are put on drug labels, that they would put that on there, because you would not know about that as a parent or a caregiver if you didn't see this here right now. If you're not having issues and it's giving you good control with the Triaminic or the Dimetapp, continue, but be aware of that, because that is one thing that's out there. You're not going to see that as much with things like loratadine or Claritin, Zyrtec or cetirizine, Allegra or fexofenadine. But the older first generation can cause that. So just, that's something to be aware of. The best thing to do if you do have a family member or a friend, or you come on somebody with a seizure, is just be there for them. It will hopefully be short term. If it's lasting more than a couple of minutes, absolutely call 911. Get somebody there, because there could be something major happening. But for the most part, for most people, it's going to be short term. They're going to come to. They're going to, as they come to, be very groggy. They may be aggressive because, hello, their body just went through the shock of a lifetime, and they're embarrassed and angry. Be ready for that. They may lash out. It's not them. It's just the response to the seizure. But do be there for them.